Question 1. A 68-year-old male complains of sudden onset, crushing chest pain radiating to his left arm, accompanied by shortness of breath and diaphoresis. His skin is pale, cool, and clammy. Which of the following is the most immediate and critical intervention? A. Administering oral glucose for possible hypoglycemia. B. Assisting him with his prescribed nitroglycerin. C. Preparing for rapid transport to a cardiac center. D. Obtaining a detailed medical history from family. Answer: C. Preparing for rapid transport to a cardiac center. This question tests your understanding of critical interventions for a suspected cardiac emergency. The keywords crushing chest pain, shortness of breath, diaphoresis, and pale, cool, clammy skin all strongly indicate an acute myocardial infarction, heart attack, and potential cardiogenic shock, which requires definitive care at a hospital. While assisting with nitroglycerin might be appropriate after assessment and medical direction, and obtaining a history is important, rapid transport to a facility capable of advanced cardiac intervention is the most time-sensitive and life-saving action. Always prioritize getting the patient to the appropriate medical facility quickly when a time-sensitive condition like a heart attack is suspected. Question 2. During a routine blood pressure assessment, the EMT inflates the cuff too rapidly, causing the patient significant discomfort. This action could be interpreted as a violation of which ethical principle? A. Justice. B. Beneficence. C. Autonomy. D. Non-maleficence. Answer: D. Non-maleficence. This question focuses on the ethical principle of non-maleficence, which is about avoiding harm. The keyword discomfort and the action of inflating the cuff too rapidly directly relate to causing unnecessary harm or injury to the patient. Non-maleficence dictates that healthcare providers must do no harm, and while an uncomfortable blood pressure reading isn't severe, it violates the spirit of this principle by causing avoidable distress. Always remember that patient care involves not only doing good, beneficence, but also actively preventing harm whenever possible. Question 3. A 2-year-old child presents with a sudden onset of stridor, drooling, and a high fever. The child is sitting upright and leaning forward, tripod position. The most appropriate initial action for the EMT is to A. Administer humidified oxygen via a non-rebreather mask. B. Attempt to visualize the airway with a tongue depressor and light. C. Encourage the child to lie down to conserve energy. D. Provide supplemental oxygen and arrange for rapid, calm transport. Answer: D. Provide supplemental oxygen and arrange for rapid, calm transport. This question describes a classic presentation of epiglottitis, a serious pediatric airway emergency, with stridor, drooling, high fever, and tripod position as key indicators. The most crucial concept here is to avoid agitating the child, as any stimulation of the airway could trigger a complete obstruction. Therefore, providing supplemental oxygen and ensuring a calm, rapid transport to definitive care is paramount, without attempting any invasive airway assessment that could worsen the situation. Remember, for suspected epiglottitis, minimizing agitation and rapid transport are the cornerstones of pre-hospital care. Question 4. You are assessing an unresponsive patient who appears to have overdosed on an opioid. After ensuring scene safety and opening the airway, you note shallow, slow respirations at 6 breaths per minute. Your immediate next action should be to A. Administer a high-flow oxygen via non-rebreather mask. B. Prepare to administer naloxone intramuscularly. C. Initiate positive pressure ventilations with a BVM. D. Auscultate lung sounds for adventitious breath sounds. Answer: C. Initiate positive pressure ventilations with a BVM. This question tests your understanding of airway management priorities in an opioid overdose. The critical clue is shallow, slow respirations at 6 breaths per minute, indicating severe respiratory depression and inadequate ventilation, which is a life-threatening emergency. While naloxone is the definitive treatment for opioid overdose, restoring adequate ventilation with a bag valve mask, BVM, takes precedence over medication administration when respirations are severely compromised, as oxygenation is immediately vital for survival. Always prioritize the ABCs, and in this case, before breathing is the most immediate life threat. Question 5. Which of the following findings would be considered a late and unreliable sign of increased intracranial pressure, ICP, in a trauma patient? A. Decerebrate posturing. B. Unequal pupils. C. Cushing's triad. D. Projectile vomiting. Answer: D. Projectile vomiting. This question asks about a late and unreliable sign of increased intracranial pressure, ICP. The concept being tested is the recognition of subtle versus overt signs of neurological deterioration. While projectile vomiting can occur with increased ICP, it is less specific and can be caused by other conditions, making it an unreliable early indicator compared to the other options. Cushing's triad, hypertension, bradycardia, irregular respirations, decerebrate posturing, an abnormal body position, and unequal pupils are all more direct and often later, but more reliable, neurological signs of significant brain injury and increased ICP. When evaluating head injuries, focus on the more specific neurological signs as primary indicators. Question 6. A 24-year-old male is found unconscious after falling approximately 20 feet from a ladder. He has a visibly deformed left forearm and an open wound on his forehead. After ensuring scene safety and assessing ABCs, which of the following should be your next priority? A. Splinting the deformed left forearm. B. Applying a cervical collar and securing the patient to a long backboard. C. Controlling bleeding from the forehead wound. D. Obtaining a full set of vital signs. Answer: B. Applying a cervical collar and securing the patient to a long backboard. This question emphasizes the importance of spinal immobilization in significant trauma. The keyword fall approximately 20 feet signifies a high mechanism injury, indicating a strong potential for spinal column injury. While controlling bleeding, splinting, and vital signs are important, protecting the spine by applying a cervical collar and securing the patient to a backboard immediately after assessing ABCs is critical to prevent further neurological damage during patient movement and transport. In trauma with potential spinal injury, always prioritize immobilization before addressing less life-threatening injuries. Question 7. You arrive on scene to find a 45-year-old female complaining of severe shortness of breath. She has a history of asthma and is very anxious. Her skin is pale and cool, and you hear audible wheezing. Her pulse is 110 bpm, respirations 28 bpm, and SpO2 90% on room air. Your initial intervention should be: A. Assisting her with her prescribed albuterol inhaler. B. Administering oxygen via non-rebreather mask. C. Transporting immediately to the nearest hospital. D. Calming the patient and reassessing her respiratory rate. Answer: B. Administering oxygen via non-rebreather mask. This question tests the immediate priority in a patient with respiratory distress and hypoxia. The key findings are severe shortness of breath, SpO2 90% on room air, and pale and cool skin, indicating inadequate oxygenation. While assisting with albuterol is a correct treatment for asthma, the most immediate life-saving intervention for hypoxia is to administer high-flow oxygen to improve oxygen saturation. Once oxygenation is addressed, other treatments can follow. Always remember to address immediate life threats, and hypoxia is a primary one, making oxygen administration the first step. Question 8. A patient is found unresponsive, pulseless, and apneic. After initiating CPR, an AED is applied. The AED advises no shock advised. What is the most appropriate next action? A. Continue chest compressions. B. Check for a pulse. C. Administer rescue breaths. D. Remove the AED pads. Answer: A. Continue chest compressions. This question focuses on the correct protocol following an AED analysis of no shock advised. The concept tested is the continuous nature of high-quality CPR. When the AED advises no shock advised, it means the rhythm is either asystole or pulseless electrical activity, PEA, both of which require continuous chest compressions rather than defibrillation. Stopping compressions to check for a pulse or remove pads would interrupt vital blood flow to the brain and heart. Always continue chest compressions immediately after an AED analysis if no shock is advised until further assessment or guidance. Question 9. Which of the following is a contraindication for the use of an oropharyngeal airway, OPA? A. An unconscious patient with a gag reflex. B. A semiconscious patient with snoring respirations. C. A patient with a suspected C-spine injury. D. An apneic patient requiring ventilations. Answer: A. An unconscious patient with a gag reflex. This question assesses your knowledge of contraindications for basic airway adjuncts. The key here is the gag reflex. An oropharyngeal airway, OPA, is designed for unconscious patients who lack a gag reflex. Its insertion in a patient who still has this reflex can induce vomiting or laryngospasm, potentially worsening the airway obstruction. While a C-spine injury requires careful OPA insertion, it's not an absolute contraindication like the presence of a gag reflex. Always ensure the patient is truly unconscious and lacks a gag reflex before attempting to insert an OPA to avoid complications. Question 10. You are called to a construction site for a worker who has suffered an open femur fracture. Significant bleeding is noted. Your initial priority after ensuring scene safety and assessing the patient's immediate ABCs is to: A. Apply a traction splint. B. Control the bleeding. C. Cover the open wound with a sterile dressing. D. Administer supplemental oxygen. Answer: B. Control the bleeding. This question tests the immediate priority when faced with significant external hemorrhage in trauma. The keyword significant bleeding from an open femur fracture indicates a life-threatening situation. While a traction splint is indicated for a femur fracture, and covering the wound is important, stopping severe blood loss is an immediate priority over applying a splint or simply covering the wound, as uncontrolled hemorrhage can quickly lead to hypovolemic shock. Remember, massive external hemorrhage should be controlled immediately after securing the airway and breathing, even before addressing other injuries. Question 11. A 72-year-old male is experiencing an altered mental status. His family reports he has a history of diabetes and hasn't eaten all day. His skin is warm and dry, and he has a rapid, thready pulse. What is the most likely cause of his altered mental status? A. Diabetic ketoacidosis, DKA. B. Hypoglycemia. C. Stroke. D. Hyperosmolar hyperglycemic state, HHS. Answer: B. Hypoglycemia. This question requires distinguishing between diabetic emergencies based on presented signs and symptoms. The key clues are history of diabetes, hasn't eaten all day, and most importantly, warm and dry skin with a rapid, thready pulse, which, combined with altered mental status, points strongly to hypoglycemia, low blood sugar. While DKA and HHS involve high blood sugar, their presentations differ, often including fruity breath, DKA, or extreme dehydration, HHS. Hypoglycemia is a critical, rapidly progressing emergency where immediate intervention, like oral glucose if the patient is conscious enough to swallow, can be life-saving. Remember, if a diabetic patient presents with altered mental status and hasn't eaten, suspect hypoglycemia first. Question 12. During patient assessment, you notice that a patient's breath smells fruity. This is a common finding in which of the following conditions? A. Alcohol intoxication. B. Hypoglycemia. C. Diabetic ketoacidosis, DKA. D. Carbon monoxide poisoning. Answer: C. Diabetic ketoacidosis, DKA. This question tests your recognition of a specific diagnostic clue. The keyword fruity smell of the breath is a classic, though not always present, sign associated with diabetic ketoacidosis, DKA. This scent is caused by the body producing ketones as it breaks down fat for energy due to a lack of insulin, leading to an acidic environment. While other conditions cause altered breath smells, a distinctly fruity odor is a strong indicator of DKA in a diabetic patient. Always pay attention to all sensory clues during assessment, as they can provide vital information for diagnosis and treatment. Question 13. A 35-year-old female complains of sudden, severe, tearing pain in her back that radiates to her abdomen. She has a history of hypertension. Her blood pressure is 180/100 mmHg, and her pulse is 120 bpm. You suspect A. Acute myocardial infarction. B. Kidney stones. C. Abdominal aortic aneurysm, AAA, rupture. D. Pericardial tamponade. Answer: C. Abdominal aortic aneurysm, AAA, rupture. This question presents a critical vascular emergency. The keywords sudden, severe, tearing pain radiating to the back and abdomen, combined with a history of hypertension and elevated blood pressure, are highly suggestive of an abdominal aortic aneurysm, AAA, that is dissecting or rupturing. While a myocardial infarction can cause radiating pain, the tearing quality and location are less typical. Kidney stones usually cause colicky pain, and pericardial tamponade typically presents with Beck's triad, muffled heart tones, JVD, hypotension, and respiratory distress. Always be alert for classic presentations of time-sensitive vascular emergencies. Question 14. Which of the following is a primary indication for administering activated charcoal? A. Suspected ingestion of petroleum distillates. B. Unresponsive patient with unknown ingestion. C. Conscious patient who ingested a poison within the last hour. D. Ingestion of corrosive substances like strong acids or alkalis. Answer: C. Conscious patient who ingested a poison within the last hour. This question addresses the appropriate use of activated charcoal. The core concept is that activated charcoal works best when administered shortly after a specific type of poisoning, and the patient must be able to protect their own airway. Conscious patient who ingested a poison within the last hour provides the ideal scenario for charcoal to bind to toxins in the gastrointestinal tract before they are absorbed. It is contraindicated in unresponsive patients due to aspiration risk, for petroleum products due to aspiration pneumonia risk, and for corrosives because it doesn't bind them effectively and can hinder endoscopy. Remember, activated charcoal is time-sensitive and requires an intact airway to be administered safely and effectively. Question 15. When assessing a pediatric patient, which component of the Pediatric Assessment Triangle, PAT, provides the quickest and most immediate information about the child's overall physiological status? A. Appearance. B. Work of breathing. C. Circulation to skin. D. Capillary refill. Answer: A. Appearance. This question focuses on the initial rapid assessment of a pediatric patient using the Pediatric Assessment Triangle, PAT. The keyword quickest and most immediate information points to the appearance component. A child's appearance, tone, interactiveness, consolability, gaze, speech/cry, gives a rapid, overall impression of their neurological and respiratory function without requiring any physical contact or equipment. While work of breathing and circulation to skin are also part of the PAT, assessing appearance is often the very first thing you can observe from the doorway, providing immediate insights into how sick the child might be. Always start your pediatric assessment with a visual sweep for their general appearance. Question 16. A 55-year-old male is experiencing a sudden onset of weakness on his right side and slurred speech. His last known normal, LKN, was 3 hours ago. What is the most critical information to convey immediately to the receiving hospital? A. Patient's medical history, including medications. B. Time of symptom onset, last known normal. C. Current vital signs and Glasgow Coma Scale, GCS, score. D. Results of your Cincinnati pre-hospital stroke scale assessment. Answer: B. Time of symptom onset, last known normal. This question highlights the paramount importance of the last known normal, LKN, time in suspected stroke patients. The keywords sudden onset of weakness, slurred speech, and LKN was 3 hours ago indicate a potential stroke. The LKN is crucial because it directly impacts the patient's eligibility for time-sensitive treatments like thrombolytics, clot-busting drugs, at the hospital. While other information is important, the LKN dictates the therapeutic window. Always prioritize reporting the LKN immediately for any suspected stroke patient, as time is brain. Question 17. You are managing a patient with suspected tension pneumothorax. Which of the following is a key distinguishing sign that differentiates a tension pneumothorax from a simple pneumothorax? A. Decreased breath sounds on the affected side. B. Subcutaneous emphysema. C. Tracheal deviation away from the affected side. D. Pleuritic chest pain. Answer: C. Tracheal deviation away from the affected side. This question asks for the distinguishing sign of a tension pneumothorax, a life-threatening condition. The concept being tested is the understanding of the physiological effects of increasing pressure in the chest. While decreased breath sounds and pleuritic chest pain occur in both simple and tension pneumothorax, and subcutaneous emphysema can occur in various chest injuries, tracheal deviation away from the affected side is a classic, though often late, sign of tension pneumothorax. This deviation occurs because the increasing pressure in the injured lung pushes the mediastinum, and thus the trachea, over to the unaffected side, indicating severe respiratory and circulatory compromise. Recognize tracheal deviation as a critical indicator of a worsening pneumothorax. Question 18. A patient is found unconscious and apneic in a smoke-filled room. What is the most appropriate initial method for opening the airway if a cervical spine injury is suspected? A. Head tilt, chin lift maneuver. B. Jaw thrust maneuver. C. Oropharyngeal airway insertion. D. Nasopharyngeal airway insertion. Answer: B. Jaw thrust maneuver. This question focuses on airway management in the context of suspected trauma. The keyword smoke-filled room implies a potential fall or collapse, thus a cervical spine injury is suspected. In such cases, the jaw thrust maneuver is the preferred method for opening the airway because it minimizes movement of the cervical spine, reducing the risk of further injury. The head tilt, chin lift maneuver is contraindicated when a C-spine injury is suspected because it manipulates the neck. Always prioritize protecting the spine when opening the airway in trauma patients. Question 19. An adult patient has a severe anaphylactic reaction after being stung by a bee. They are hypotensive, tachycardic, and have significant difficulty breathing with audible wheezing. Which medication is the most critical and immediate intervention? A. Diphenhydramine, Benadryl. B. Albuterol. C. Epinephrine, EpiPen. D. Prednisone. Answer: C. Epinephrine, EpiPen. This question tests the understanding of the immediate treatment for a severe anaphylactic reaction. The keywords severe anaphylactic reaction, hypotensive, tachycardic, and significant difficulty breathing with audible wheezing all point to a life-threatening allergic response. Epinephrine is the most critical and immediate medication because it acts quickly to vasoconstrict, raise blood pressure, bronchodilate, open airways, and reduce swelling, counteracting the effects of anaphylaxis. While other medications like diphenhydramine or albuterol may be given as adjuncts, epinephrine is the cornerstone of emergency treatment. For severe allergic reactions, always think epinephrine first. Question 20. A patient presents with crushing chest pain, diaphoresis, and a history of heart disease. After assisting with prescribed nitroglycerin, with medical direction, the patient's blood pressure drops from 120/80 mmHg to 90/60 mmHg. What is your next most appropriate action? A. Administer a second dose of nitroglycerin. B. Elevate the patient's legs and administer oxygen. C. Administer oral glucose for potential hypoglycemia. D. Prepare for immediate transport and reassess vital signs frequently. Answer: B. Elevate the patient's legs and administer oxygen. This question addresses managing an adverse reaction to nitroglycerin in a cardiac patient. The critical clue is the drop in blood pressure from 120/80 mmHg to 90/60 mmHg after nitroglycerin administration. Nitroglycerin is a vasodilator, and a significant drop in blood pressure indicates that the patient is experiencing hypotension, potentially due to the medication. The most appropriate immediate action is to elevate the patient's legs to improve venous return and administer oxygen to support tissue perfusion, while preparing for transport. Administering more nitroglycerin would worsen the hypotension, and oral glucose is for hypoglycemia. Always be prepared to manage side effects of medications, especially hypotension after nitroglycerin. Question 21. When conducting a rapid trauma assessment on an unconscious patient, which area should be assessed last to prevent potentially worsening an injury? A. Head. B. Chest. C. Pelvis. D. Extremities. Answer: C. Pelvis. This question focuses on the technique for a rapid trauma assessment, particularly in an unconscious patient where you cannot elicit pain responses. The concept is to assess the body areas in a sequence that minimizes the risk of exacerbating critical injuries. The pelvis should be assessed last, and only once, to check for instability. Excessive or repeated manipulation of an unstable pelvis can worsen bleeding and further injure the patient. While all areas require careful assessment, the pelvis is uniquely vulnerable to aggravation with improper handling. Remember to assess the pelvis carefully and only once to avoid increasing internal hemorrhage. Question 22. A child has ingested a small amount of liquid drain cleaner. The child is conscious but has burns around the mouth. What is the most important intervention? A. Induce vomiting with syrup of ipecac. B. Administer activated charcoal. C. Immediately administer milk or water to dilute the substance. D. Rapid transport without attempting to neutralize or dilute. Answer: D. Rapid transport without attempting to neutralize or dilute. This question addresses the critical management of corrosive ingestions. The key phrase liquid drain cleaner indicates a corrosive substance, strong acid or alkali, and burns around the mouth confirms this. For corrosive ingestions, inducing vomiting or administering activated charcoal is absolutely contraindicated as it can cause further damage to the esophagus and airway. Attempting to neutralize with milk or water is controversial and potentially harmful, as it can cause a heat reaction. The most important intervention is rapid transport to definitive care for specialized treatment, without further intervention in the field. For corrosive ingestions, prompt transport is the safest and most effective pre-hospital action. Question 23. You are assessing a patient experiencing severe pain in the lower right quadrant of the abdomen, with rebound tenderness. The patient reports nausea and vomiting. Which condition are you most concerned about? A. Cholecystitis. B. Appendicitis. C. Pancreatitis. D. Ectopic pregnancy. Answer: B. Appendicitis. This question describes a classic presentation of appendicitis, a common abdominal emergency. The keywords severe pain in the lower right quadrant, rebound tenderness, and nausea and vomiting are highly indicative of inflammation of the appendix. While other conditions can cause abdominal pain, the specific location and rebound tenderness are strong clues for appendicitis. Cholecystitis typically presents with upper right quadrant pain, pancreatitis with epigastric pain radiating to the back, and ectopic pregnancy, though it can cause lower quadrant pain, would also have a relevant gynecological history. Always look for the constellation of symptoms that point to a specific diagnosis, especially in acute abdominal pain. Question 24. A patient is found lying supine on the floor, unresponsive and breathing at 4 breaths per minute. There is no evidence of trauma. After opening the airway, what is the most appropriate next step? A. Apply an AED and analyze the rhythm. B. Perform a rapid head-to-toe assessment. C. Initiate ventilations with a bag valve mask, BVM. D. Administer supplemental oxygen via non-rebreather mask. Answer: C. Initiate ventilations with a bag valve mask, BVM. This question focuses on the immediate management of a patient with severe respiratory depression. The critical clue is breathing at 4 breaths per minute, which is inadequate to sustain life. While supplemental oxygen is important, it will not be effective if the patient is not moving enough air. The most appropriate next step is to initiate positive pressure ventilations with a bag valve mask, BVM, to assist the patient's breathing and ensure adequate oxygenation and ventilation. An AED is for cardiac arrest, and a head-to-toe assessment comes after life threats are managed. Always prioritize addressing immediate life threats, and severely depressed breathing requires immediate ventilatory support. Question 25. A 4-year-old child presents with a high-pitched, harsh sound during inhalation, stridor, after choking on a small toy. The child is still conscious but struggling to breathe. What is the most appropriate initial intervention? A. Perform a finger sweep to remove the object. B. Administer back blows and chest thrusts, infant, or abdominal thrusts, child. C. Deliver 5 sharp back blows between the shoulder blades. D. Attempt to ventilate with a bag valve mask, BVM. Answer: B. Administer back blows and chest thrusts, infant, or abdominal thrusts, child. This question addresses foreign body airway obstruction, FBAO, in a conscious child. The keywords are stridor, choking on a small toy, and struggling to breathe while conscious. For a conscious child, over 1 year old, with a severe airway obstruction, the appropriate intervention is to deliver abdominal thrusts, Heimlich maneuver. For an infant, under 1 year, it would be back blows and chest thrusts. A finger sweep is only for unconscious patients if the object is visible, and attempting to ventilate would likely push the object further down. Always follow the specific guidelines for FBAO relief based on the patient's age and consciousness level.